Welcome to day 2 of the 10th annual ALD Standards of Care Conference. Good morning to all our virtual attendees as well. I want to give a quick thank you to Elisa for bringing us together for what I can't believe is 10 years. Thank you to the staff at the Ace Hotel and Surreal Productions for all the different ways we're able to bring this event to you guys today. And of course, thank you to our sponsors of the 2026 conference, which is Genetics Biotherapeutics and Minerix Therapeutics. So I was really moved by Elisa's reflection yesterday. I actually didn't realize she had put all that together, and it made me think about my journey. And while I don't want to go all the way back to the beginning, because that can be hard, it made me think about the very first time that Elisa asked me to present at this conference, much like Elisha shared her story yesterday, and Samantha is going to be sharing her story soon after me. So this was 7 years ago. In 2019, I called my talk Jack and the ALD Stuff. I think I've gotten a little bit better at titling my presentations since then. But back then, I was just a new mom to this community. And I think I put that in quotes because I knew I didn't want to let this take over our lives. And I think at the time, I only wanted to be thinking about ALD every 6 months. And obviously, that didn't happen either. But I think it's for the better, and I think my family's for the better because of that. And then I'm not going to go through all the slides, but I thought this was really important for us to look at today because I had ended that presentation with a wish list of what I wanted at the time, again, 7 years ago. So, I mean, if we look at these bullet points, gene therapy was super important to me, not just personally as the mom of what I knew, would be an only child. The equity piece has always been really important to me, and I just wanted an expanded trial at that time. We now have an FDA-approved gene therapy that has helped save so many boys, and I'm so grateful that that option exists for the patients that really need it, that don't have a match. Continued research, not just exploring this through this organization and the other organizations that existed, like ALD Connect at the time, but just looking out at the audience now of new newborn screening parents that have started their own endeavors, and it's beyond, I think, what Elisa ever could have pictured, would have imagined. So it's just amazing how many people have contributed from this time on to the research opportunities. Newborn screening everywhere. So does anyone want to take a guess back in 2019 how many states were screening? Just throw a number out. It was 10. Way to go, Lena. Yeah, it was only 10, so it's incredible now that we're up to almost 48 states. A universal monitoring schedule. So at the time that we were diagnosed, there was no publication for this that a local team could refer to, and now we have several publications, and we have a parent's guide that's written in parents' language. So this, and it's getting out to families as soon as they request one. So I think that's amazing. Enough ALD specialists, this is something I do still worry about to this day, but when I look at some of these younger, brilliant minds coming up, like Alexis yesterday, it gives me so much hope to see that energy and excitement for this rare disease field. So I think we'll get there. I really wanted MRI video goggles. And my local team is here, so I know they'll get a kick out of this because Dr. Rains was so wonderful when I mentioned this first technology to her. We both took a field trip together to Sloan Kettering to view the goggles, and we both said, wow, we really just have to get this at Mount Sinai. And we're like 92% of the way there because as of our last MRI, they did get a pair of goggles. Unfortunately, they put it on the wrong MRI. It's on a 1.5, not on a 3, so we have to work on that. But that's more personal, and I do think that technology is so important. I remember being very nervous about the anesthesia, and I'm really glad, too, that there's more awareness about this technology and more hospitals trying to get this and having the buy-in of the care team also to help push this along. And then let's study the healthy ones. So I had meant this more, again, in a personal way as a family with a pathogenic variant that fortunately has never been severely impacted by symptoms. But it's funny how this has really evolved over the course of several years. And now I look at this bullet point and I'm like, well, the gray zone's kind of doing that in a different way than what I had pictured. And we're going to talk about that today through the panel, which I'm really looking forward to. So again, I just think as a community, this is really important to see. And for the new families that are here or listening on Zoom, thinking about your wish list 10 years from now, you might get it. So I hope that brings you hope. Again, I want to thank our sponsors, not just for today, but for the support that you provide us all year long with the education and resources that we are able to provide for our families. I want to thank our tiny but mighty board who are all here today. We couldn't do what we do without your guidance. And then I think we all know about the ALD Alliance, and I'm so grateful to be able to say Aiden's name every day as I advocate through this organization. And whenever I'm only given a sentence to explain it to someone new to this community, I just say this really started with a promise that Elisa made to her son. And as I mentioned, now we are at 48 states, and it's really turned into Elisa not wanting these other small rare disease groups having to go through what she went through, having to testify 50 times and navigate what each state government looks like and the resources that they desperately need that they don't necessarily have to implement. And that's how it really came to be more of a newborn screening advocacy organization, and I'll talk about that in a little bit. So I always do a since we last saw you slide when it comes to ALD newborn screening. So North Dakota did start screening as of February 3rd, 2026. They were kind enough to join our newborn screening consortium call on Wednesday to report how many babies they've screened. No ALD cases picked up yet, but thank you, Amy, for being on that call and listening in. And then also, as Elisa shared yesterday, we got a really hopeful letter from Massachusetts that their pilot program that had been running, I think for about 6 or 7 years, which gave parents the opportunity to opt into ALD screening, will be coming to an end, and they'll be going full population wide sometime in the spring. We don't know exactly when, but we're very lucky that ALD newborn screening mom, Christy Higuera, is very active and on the newborn screening advisory committee, and I'm sure she will let us know. We'll probably hear her from Massachusetts with joy when we hear that they have converted to full population screening. And then that really only leaves 2 states left. The state of Louisiana has been working very hard inside the lab, and it really comes down to instrumentation and advances in their information technology. What I like, if you go on the Louisiana Department of Health website, they added this tracker, which I think is so great, especially with all the conditions that are coming out, being recommended from the Recommended Uniform Screening Panel. So you can click on all the various diseases and see what stage they're in the process. It's a 5-step process, and ALD is in the 5th stage, which is implementation. So while they can't give an estimated live date, we hope that will be very soon. And Alaska actually voted, their newborn screening advisory committee voted ALD in 2024. So the advocacy piece isn't really needed there. It's a financial piece, and we're working on some things behind the scenes to hopefully get that going so that they can add ALD and quite a few other conditions because they're behind. And that kind of also folds into our universal RUSP advocacy piece, which I'll talk about in a little bit. But first, I just want to remind everyone of our resources. So this one's really close to my heart, the ALD Newborn Screening Care Package Program. It's now 5 years old, and this was born out of a couple things. I thought about myself, what resources we could have used that we didn't have, because we were diagnosed so early in when ALD was first added. And then we also started it during COVID. I think it was our first or second conference where we couldn't be meeting in person, and it was just so hard to not be able to connect with the families, especially the new ones. So they really just started out as care packages going out to those families that we couldn't meet with in person, and the response was so great that we just wanted to turn it into something that we could be doing year-round. So since we started it in 2021, we've sent out 141 care packages to 33 states. The packages contain the Parents Guide to ALD, which again is the simplified monitoring guidelines for parents based on Dr. Malak's publication. Our Coping with an ALD Newborn Screening Diagnosis, which is more about the psychological impact of the disease. An MRI-safe teddy bear, which my son still uses at 10. The Donut That Roared, A Child's Guide to Surviving an MRI. This is such a great book. Again, we read it before every MRI. And our Hope onesie, so everyone can be fashionable for their clinic appointments. And I want to thank Travere Therapeutics and Amgen for sponsoring this care package program in the past. And then in addition to the resources I mentioned in the care package, obviously this conference has meant so much to I think all the stakeholders in this community. I think we do a really good job with coming up with some creative panels and conversations for these families that are first given this diagnosis. One of my favorites is here, Adrenal Insufficiency Parenting, What's in Your Toolkit? And a lot of our ideas just come from you guys, from the parents and from the families. So thank you for that, and I'm glad we can provide this outlet to see what new families really want to hear about. And then 2 years ago, we also did Lunch and Learns. I presented on this last year. We met with, I think, 8 out of 10 of the metabolic centers in New York. So this is when the newborn screening diagnosis comes in, where the families are first sent to. And it was so great, I think not just for the clinics, but for us to get that feedback about what they're hearing from the front lines. And we really want to replicate this in other states. And then these are some new resources since we last spoke to you last year at this conference. So that looks like our Parents Guide, but it's actually the Canadian version, which was just published, I think less than a month ago. So this was so great. A lovely mom named Riham from Canada reached out to us, who's been doing some advocacy work there, and said, I really want to have a Parents Guide for these Canadian families. I believe one of their territories has a pilot already going for ALD newborn screening, and they're expecting others. So she wanted to be prepared and reached out to Elisa. So, we had a couple meetings, reached out to our board, and they're already in print. I believe she's already working on her own care packages, which is just the highest compliment possible, and so great that this work will be extending to another country. And what's really nice too is, and I remember this being important to Elisa when she first created her guide, is that there's all Canadian families, their pictures in the guide. So we wanted to make sure you all knew about that. Our second new resource is for families when they are going for their blood draws, when the boys are going for their every 3 months or every 6 months blood draw for cortisol and ACTH. Not so much at the expert centers, that's not really a concern here, but as a mom who's had to do monitoring at your local Quest or LabCorp, there were several times when my son had his blood drawn and they forgot that the ACTH sample needs special handling. And it's unfortunate because then you don't get the value and then you have to go back for repeat blood draws. And when I reached out to the community, I heard there were a lot of other families that this was happening to that were in the same boat, again, that were mostly doing it at labs local to them, especially if they're far away from their expert center. Obviously, it's hard to drive 4 or 5 hours just to get blood work done. So we created this. It's the first and last time I've ever used ChatGPT to create a resource. But I'm proud of it, and we're getting really good feedback that, the phlebotomists are seeing it, and, whether it's a reminder or, we actually heard from a mom that said it was helpful in another way because they had only had the cortisol script and not the ACTH, so it again saved another stick. So this you can download off our website, or if you're an endocrinologist listening, I'm happy to mail a bunch to you if this is a problem you also run into. And then we heard from Alexis yesterday about these great FAQ sheets that she came up with. You can also download these off our website. And please, if this is something that your center has, please use them. Like I said to Alexis, I knew about this opportunity, I think, when we were first diagnosed, but I didn't understand it. And in my mind, it was sort of, well, do I really need to do another test? And after spending the year plus that we worked on this and now understanding not just the impact it could have had on my family, but the research aspect of it, I absolutely would have found a way to do this. So please use that resource, because I think it will definitely help, especially if you have a family that's not sure if they want to participate in that aspect of this. Okay, and then I'm going to transition onto our expanded newborn screening advocacy. This is beyond ALD. Again, we're clearly in the home stretch. This is all about not having other families and rare disease groups having to wait the 10 plus years from when their disease is added onto the recommended federal panel. It's really important to us that we shorten that time and truly eradicate what we call death by zip code. And this work is done through the Newborn Screening Alliance, which is simply a branch of the ALD Alliance. The Advisory Committee on Heritable Disorders and Newborn Screenings in Children was disbanded last year. So this was a really important mechanism and a way for these rare disease groups to get their disease reviewed. It's a crazy, complicated, but important process, and it wasn't perfect. It had its flaws, but it's really what most of the states would follow as their gold standard as to whether or not they should add a condition. So with that committee being disabled, there's been a lot of chaos in the newborn screening committee and the newborn screening community over this. Secretary Kennedy did sign in MLD and DMD. But again, we have to come up with a new way on how these conditions can be reviewed. And Michelle's going to talk about the different avenues and the different ways that this can happen, because this was a big focus of our discussion on Wednesday when we met with the newborn screening programs and also some of the other advocacy groups. And then our third bullet point is really what's always been our number one, having the privilege to work so closely with the newborn screening programs, and that's finding a way to provide a steady stream of funding for these programs so that when it is RUSP approved, they can add it in a reasonable amount of time. So that brings us to our new federal initiative, which is called the Surge to Save. And very simply, it's a funding surge to screen every baby in every state for the rare and treatable conditions that have a viable newborn screening test and an FDA-approved treatment. So in all the years that we've been advocating for this, the million-dollar question, right, that we get asked, not just from our own ALD community, but even other newborn screening advocates, is, well, how much will this cost to do? And Rose from Travere Therapeutics, one of our amazing partners in this advocacy work, spoke about this on Wednesday at our newborn screening consortium. And she used the term that we've been doing a lot of back of the napkin math for quite some time to figure this out. And I'm so happy to report that thanks to Trevere, we finally have a report that was issued by Minot that gives us a dollar amount. And I'll get to it in a minute. And I am really proud because our back of the napkin math was pretty close to accurate. But before I explain and show you what the amount is, I just want to explain what that would look like when it comes to federal funding in Congress, because those of you that have been following along with us on this, advocacy journey for general newborn screening, we've talked a lot about appropriations the last 5 years, which is really a line item in the budget, and there's a lot of steps to it. And this is going to be something that's completely different. It's going to be modeled after what's called the Special Diabetes Program, which I believe was put into effect it was in 1997. It started out as a $150 million allotment, which was $30 million over the course of 5 years. It was only supposed to be 5 years, and as of in 2024, it was up to $800 million. So it comes directly from the Treasury, so it kind of bypasses all of the steps that are needed for appropriations. And if it doesn't work out, it could be sunsetted, but again, looking at what happened with diabetes, we think this could be a really successful model, especially as we think about all the other conditions that might be coming down the pipeline for federal recommendation. So now I'm going to show you the number, 173 million. I know it sounds like a lot, but it's really, as Elisa always says, a drop in the bucket when it comes to the federal budget. I would encourage all of you to check out this website, surgetosave.org. We have this really cool interactive map where you can click on the state, and it will tell you not only what conditions they aren't able to screen for yet by the state, but the dollar amount, again, estimated via the Minot report of what that cost would look like for that state. So this is gonna be a really, really great advocacy tool. I'm so excited, again, not just to finally have that dollar amount, but to have a tool like this, because a lot of these newborn screening maps exist, but to have that dollar amount tied to it, I think is gonna be really important when we start meeting with legislators. So please check that out. And there's also a way to sign on if this is something you wanna help talk to your local politician about. There's a button you can click to kind of join the campaign, and then you'll be updated on all of that. And I also want to add that there's a lot of other initiatives going on in the newborn screening landscape, and Michelle's going to talk about that in a little bit, but the funding piece is what's really always been our number one priority, which is why I'm focusing on this. And this will be our main push this year when it comes to federal advocacy. And then before I bring Michelle up, just what we're looking to accomplish this year. Again, every baby, every state, not just ALD. We want to continue our family support via the care package programs, this conference, and Aiden's Gifts, which is a small program, but it allows us to provide travel scholarships to events like this, and sometimes even just transportation to a really important appointment for a family. The clinician support, again, this conference, wanting to expand our lunch and learns. Research, getting to work with Alexis this year on the neuropsychology FAQ sheets. It kind of all started with the conversation that we had with Dr. Pierpont during COVID, and wanting to work on this psychological impact piece. And that publication is something that came out of that work, and it was so important, and we're so grateful to Dr. Rini for that, because it was really, from my understanding, the first publication that focused on the psychological impact of this disease. So we're so grateful that that's there now and that the work is expanding. As Michelle discussed yesterday, the ALD Incidence Project, I think she mentioned by mid-26, hoping to wrap up the data collection portion of that, and then excited to talk about what we might want to focus on next. And then just looking into the next decade, of course, the fundraising piece is so important. I don't think we've talked about it yet today, so I just want to bring your attention to, on the table, we started this really cool fundraiser this year. It's a portrait raffle. That's a portrait of Aiden and Sienna that I know is so close to Elise's heart. She always says how Aiden is just so perfectly captured. The artist is a close friend of hers, very talented. So if you join that raffle fundraiser, you could be entered in a chance to win something like that. And that's it for me. So I'm gonna bring up Michelle to talk about all the other wonderful things going on in newborn screening advocacy. Thank you.